learners. Welcome once again to another MOOCs lecture of BP 103T. We are dealing with Unit 5, that is Introduction to Semi-Solid Dosage Form. I am Anjali Mishra, Assistant Professor at Noida Institute of Engineering and Technology, Pharmacy Institute, Greater Noida. So, let us start with today's lecture. Basically, in the previous lecture, we had studied about what is semi-solid dosage form. We had understood about different types of semi-solid dosage form. So, among different types of semi-solid dosage form, we had studied about ointments, creams, gels, suppositories, paste, different types of cataplasm, poultices and many more. In this lecture, we are going to focus on specifically preparation of ointments, how it is prepared, what are the characteristics of ointment, we are going to study in detail. So, let us start. So, as you all can see, we are writing or we are studying about ointments. So, ointment, when we hear this word ointment, what comes in our mind? The very first thing that strikes us is thick preparation. So, definitely ointment is a semi-solid preparation and the viscosity of the ointment is quite high when we compare it with any other semi-solid dosage form, for example lotions. So, can I say it is a viscous semi-solid formulation? It is extensively used for external or for topical applications, because we are very well aware that semi-solid formulations are majorly applied onto the external surface on the skin and also on the mucous membrane. So, in the same manner, ointment are also applied on the skin as well as on the mucous membrane. It can be applied on the skin and the mucous membrane, as just now I have stated. It usually consists of an API and also a suitable base. We are going to understand what is base and what is API. It is very much evident that API is any chemical or moiety which has something activity in it. As a result, it is named as API, that is active pharmaceutical ingredient, and this API is always incorporated into certain substances known as base. This base is actually present in a highest amount and this base helps to incorporate the API into which we want to formulate that particular ointment. So, as discussed earlier, ointment can be of various types. It can be of suspension and at the same time it can be emulsion as well. As you can see in the picture that I have pasted here, it is a preparation that is often very much thick and it is of high viscosity and it is supplied in a collapsible tube. So, this is all about ointment. Let us understand what are the advantages and disadvantages of ointments. So, first of all, it is very easy to handle when we compare ointment as compared to the liquid dosage form. For example, if I consider ointment in comparison to syrup, in comparison to lotions, the handling of this preparation is often very easy when we compare it with liquid dosage form. Now, another advantage of ointment is it gives site specific action. So, can I say it does produces a targeted response? So, yes, ointments have a tendency to get apply or adhere on the area where it is applied, and at the same time it has a tendency to give site specific action. So, that is another advantage of ointment. Then it is chemically stable. Now, when I say ointments are chemically stable, what do I mean? I mean that ointments or the semi-solid dosage forms are far more stable as compared to liquid dosage form. However, here I would like to add something. Their stability is often considered to be less when I compare it with solid dosage form. So, stability, however, ointment have higher as compared to liquid dosage form, but at the same time there is a slight decrease in the stability when we compare it with any solid dosage form, for example tablet, capsules and many other. Another advantage of ointment is that it can be suitable for unconscious patient as well. For example, if a patient is not in her or her consciousness, if the patient is lying on bed and or if the patient is undergoing some serious condition. So, for that patient also it is easy for us to administer semi-solid dosage form, because that thing does not require a patient to be awake from, or it is a non-invasive type of medicament or dosage form. Hence, we do not require the patient to be awake while administering these drugs. Next advantage of ointment is that it has the tendency to give a better and prolonged action because of its stronger adherence to our tissue or the area where it is applied. So, ointments are thick preparation. As a result, it has the tendency to get applied onto the area on where it is applied. Now, being thick, there is a high tendency of the ointment in order to get stuck or in order to adhere to the surface where it is applied. So, if the adherence is high, it is automatically said that the time of contact is definitely high, and if the time of contact is high, the time or the interval through which the drug or the API is going to produce action is definitely going to be high. So, these are some of the advantages of ointment. At the same time, I would also like to cover some of the disadvantages of ointment. First of all, it has less dose accuracy. In the previous lecture also I had mentioned semi-solid dosage form. The major disadvantages of semi-solid dosage form is that it has few drawbacks or few contraindications, that the accuracy often restrict us in order to actually ask a patient to take this, because we know that whenever we are applying any medicaments, any ointments, there is no fixed dosage up to where we are supposed to administer that medication. Hence, this is a major drawback of semi-solid dosage form, be it any of the semi-solid dosage form, be it creams, be it ointments, be it gels or jellies, and many more. Next disadvantages of ointment is that there is a tendency of high contamination or high risk of contamination, because the semi-solid dosage form, be it your creams, be it your ointments, are often applied with the help of hands or fingers. So, we cannot always tell a patient to wash their hands or to always be sterile while applying this ointment. Hence, there is a high tendency that ointments may get contaminated. As a result, this is another disadvantages of ointments. Then, going on to the third disadvantages, sometimes if certain kind of medications are used in ointment, there is a high risk or tendency that staining might occur, and this staining might occur of the area where it is applied, and at the same time staining might occur onto the cloths that a patient is wearing. So, staining is a completely no undesirable phenomena. However, when we are using certain kind of medication, staining might occur. Then, eventually concluding the disadvantages is that ointments are often bulky to handle as compared to solid. So, it is a very crystal clear thing whenever we want to handle 100 packet of tablets, and at the same time if we want to handle 100 packs of ointments. So, which is going to be more easy? Obviously, the 100 pack of tablet is oftenly more easy to handle, more easy to carry. Hence, we can say that ointments are often bulky to handle. So, this is all about the advantages and disadvantages of ointments. Moving on to the next slide, let us understand the types of ointment. As you all can see on the screen, ointments are majorly classified into two types. The first is medicated ointment and the another one is non-medicated ointment. So, medicated ointment, as the name implies, it contains any active pharmaceutical ingredient. Now, depending upon the usage, the type of medicated ointment may differ. For example, as you all can see here, we have an example known as neomycin ointment. So, neomycin is a antibacterial ointment. So, if we want an active antibacterial effect, we can go for neomycin ointment. And another example is salicylic ointment. So, whenever we need to have treatment for psoriasis, eczema, for any of the fungal infection, we can go for salicylic acid ointment. So, depending upon the usage, the type of ointment may vary. Now, moving on to another type of ointment known as the non-medicated ointment. So, non-medicated ointment is a type of ointment which do not contain API in it or any of the active pharmaceutical ingredient. So, the question implies, why do we use non-medicated ointment. Actually, non-medicated ointment are majorly used for the purpose of providing lubrication or for the purpose of providing emollient effect. Now, what is emollient effect? Emollient effect is a simple effect which is a phenomena which actually hydrates or moisturizes the skin. That phenomena is known as emollient effect. Now, let us understand what are the different methods through which we can prepare ointments. So, basically, whenever I talk about ointment, so ointment is a sort of preparation in which we have to keep two things in mind. So, when I say ointment, so there is two important things that has to be kept in mind. The very first important thing is there is a presence of API in it if the ointment is a medicated type, and at the same time this API cannot be administered in a simple state to a patient. You cannot administer API directly to a patient. As a result, we need the help of a particular substances which we call it as base. Without base, we cannot formulate ointment, we cannot formulate suppository, we cannot formulate creams or any solid dosage form. So, majorly when we are thinking about preparation of semi-solid dosage form, what we have to keep in mind is that a medicament or an API which is incorporated into a particular thing is known as base, and without base we cannot formulate any of the semi-solid dosage form. Specifically, we are talking about ointment. So, here without base we cannot make ointment. So, bases can be of various types, and here we have categorized bases into four major types. First is oleogenous bases, another one is absorption bases, the third one is water removable bases, and lastly fourth one is water soluble bases. So, these are the four different types of bases which are majorly used in order to formulate ointments. We are going to see each and every basis in detail. So, let us understand very first type of base known as oleogenous bases. They are also called as hydrocarbon bases. Initially, when you apply these bases onto the application area, be it the mucous membrane, be it the surface of the skin, what is the first thing that these type of bases are going to do? They are actually going to prevent the escape of moisture from the particular area where it is applied. So, basically can I say they produce a emollient effect by preventing the escape of moisture from the area where it is applied. So, they also act as an occlusive dressings. For example, if I have got an injury on any of the exposed part, then there is a high risk that I may actually damage that entire part. So, at the same time, ointment is often a great choice because that actually prevents the escape of moisture from the area where it is applied. So, ointment act as a great choice for occlusive dressings. Then few example of your oleogenous bases are petrolatum, white petrolatum and yellow ointment as well as white ointment. So, the major thing that we are supposed to keep in mind here is oleogenous bases are majorly called as hydrocarbon bases, and they prevent the escape of moisture from the area where it is applied. Then let us understand another type of bases known as absorption bases. So, absorption bases are basically the bases that adhere or absorb the area or the presence of the water that is present onto the area where it is applied. So, this type of bases actually permits the incorporation of aqueous solution resulting into the formation of W by O type of emulsions. So, if the agent or the API is actually water soluble or hydrophilic in nature, for that cases we are supposed to use hydrophilic bases because that is going to help to incorporate the major medicament into the base. So, for that purpose we will always go for absorption bases. Those that are water in oil emulsion and permit the incorporation of additional quantity of aqueous solution. For example, it is lanolin, which is also known as wool fat. So, depending upon the choice of or depending upon the category of the API that we have, we may choose the types of bases. So, if we require the facilitation or the transportation of water soluble ingredient, then we definitely may go for absorption bases. The third type of base is water removable base. From this name only, we can understand that what kind of base is this. It is self-explanatory that such kind of bases can be easily removed by the addition or by the application of free flowing water. So, in the same time, they are majorly favorable for O by W type of emulsion. If we have a ointment which is majorly of oil and water type, for that cases we can definitely go for water removable bases. So, external face of the emulsion is aqueous, hence they are easily washed from the surface of the skin or the mucous membrane where it is applied. As a result, they are also called as water washable bases. So, for example, if we want an ointment to be non-greasy, to be easily removable or to be easily water washable, we are definitely going to choose a base known as water removable base. There are examples of water removable base. For example, that is hydrophilic ointment. Now, moving on to another bases known as water soluble bases. Then water soluble bases actually do not contain oleogenous compound. Now, oleogenous compound means anything that is actually has fatty content in it. So, here water soluble bases do not contain anything that is actually of fatty origin or lipophilic origin. So, basically they are completely water washable and they are called as greaseless bases. So, if we want literally greaseless bases, greaseless ointments, we may definitely choose water soluble bases. They often or they soften create greatly with the addition of water. So, whenever we keep on adding water to these bases, they have a tendency to become soft and to easily adhere the API into which it is incorporated. They are mostly used to incorporate the solid medicaments. If we want to incorporate solid medicaments into that, it is very much favorable that we go for water soluble bases. For example, PEG. This is also known as PEG, polyethylene glycol. Moving on ahead, we just saw now different types of bases. For example, oleogenous bases, water soluble bases, water insoluble bases, hydrophilic bases and water removable bases. But what actually gives an idea that what kind of bases should we go for? What is the basic criteria to select a basis? Let us understand that. First of all, the release rate of the bases must be appropriate. For example, if you choose a base, just if you do not have an idea how to choose a base and you have just selected the base randomly, what if that base do not give you the actual release that you wanted? So, that is going to be a hindrance or problematic in order to produce a certain biological activity. So, release rate plays a very important role in order to understand that what actually the release, how much actually the API is getting released from the base in which it is incorporated. Now, the another thing that plays an important role is topical or percutaneous drug absorption. Now, how much our drug is going to get absorbed through various pathway into the dermis and eventually to the subcutaneous layer, that actually help us to understand that which base we should go for. So, this also plays an important role. Another criteria in order to select our base is occlusion. Occlusion is nothing but it is an adherence of particle. If there is a formation of lumps when we take a particular base, then that phenomena is completely undesirable, then we may not go for that phenomena. So, occlusion help us to understand that which base we must go for. If occlusion occurs, then that base is completely an undesirable base. Another thing, stability of drug. Now, selection of base depends upon how stable our drug is in that particular base. If our drug is unstable in that base, how good is that base, that is actually not going to govern. Even though if the base is of good quality, good stability, then if our drug is not stable, we are not going to select that particular base. Another criteria is effect of drug on ointment base. If our drug is actually not being compatible with that base, or if it is reacting with a particular base, or if the base is not inert, then that base is not to be used for the preparation of a particular ointment. Basically, what I am trying to say is the base which we are using in order to produce or in order to make an ointment must be inert. Then next criteria is the base must be easily removable from the surface onto which it is applied, because we do not want any sort of struggle that we are supposed to do when we are removing a particular base. Hence, characteristics of surface for application. That particular base, if it has certain characteristics, if it has certain peculiar characteristics that makes it different from any another base, is oftenly a good criteria while selecting a base. So, this is all about the criteria that we must follow while selecting a particular base. Now, let us understand how to prepare ointments, what are the different methods in which we can prepare ointment. So, majorly we have classified the preparation method into two major types. The first method is incorporation method and the another method is the fusion method. Incorporation, in a simple word, it means addition of something, incorporation. So, here the incorporation can be divided into two types. Incorporation of solid sometimes can occur, and at the same time incorporation of liquid can also occur. We are going to study each method in detail in the next slide. So, let us understand what is incorporation method, as this word implies incorporation. So, when we hear this word incorporation, we have to understand incorporation means addition of something. So, incorporation can be occur for solid medicaments as well, and for liquid medicaments can also occur for liquid as well. So, here the diagram or the picture that is presented on the screen represents the incorporation of solid medicament into the base. So, let us understand, the white portion that we can see here is the base, any base. It could be water soluble base, it could be oleogenous base, it could be any bases. So, this pink thing that we can see here, it is nothing but it is the API, it is the active pharmaceutical ingredient. Now, let us understand that how incorporation takes place. So, first of all, this base is present and we can see small amount of this base has been added it into the API. So, can I say this base is added in a smaller quantities into the API? As a result, small addition of base occurs into the API. So, this small addition is done by a method known as geometric dilution. Geometric dilution. So, this geometric dilution means if the quantity of the API is 5 gram, then at a time you are supposed to take only 5 grams of base. Now, the quantity has become 10 gram. Now, the next thing that we are going to do is we are going to take 10 gram of the base from it. So, we are going to perform the serial dilution or the geometric dilution by considering the quantities of the API or the base present. So, this method simply implies incorporation of bases. Now, let us understand the next method of preparation of ointment, and this method is known as fusion method. Now, fusion method is a method which we actually use for preparation of ointment on a larger scale, because whenever we want to prepare ointments on a huge quantity on an industrial scale, this method is more economical as compared to the method that I just now mentioned. Here what we do is, first of all, we melt the bases, because bases generally are present in a solid state. However, in order to incorporate the API we are supposed to melt the base at a particular temperature. So, initially what we do here is we melt the bases. The bases can be of any choice. There are 4 types of bases, just now I have mentioned. Now, depending upon our choice, depending upon our criteria, the bases might change or might differ. But the very first thing that we are supposed to do is we are supposed to melt the base. Now, the base is here in the liquid state. Next, what we are going to do is we are going to add our API and any other excipients that we are supposed to add. These excipients can be buffer, might be PA, might be antioxidant, might be preservative, it can be anything. Now, what we are doing is we are adding the API into the melted base. Again, what we are doing is we are rapidly congealing. Congealing means we are rapidly cooling or we are rapidly freezing the base. Because if we do not rapidly freeze, then there are chances that there is a chance of fungal infection, fungal growth or any sort of unwanted growth might occur. But at the same time, here I would like to add here is, if the API or any other excipient that we are adding into this liquid basis, if it is thermolabile, thermolabile means a substances which is actually susceptible to heat. If it does not like heat, then we have to be cautious and we are not supposed to add that thermolabile substances in this step, and what we are supposed to do is we are supposed to add during this rapid congealing process. So, this is all about fusion method. Now, we are going to understand, when we have prepared ointment, we have understood how ointment is prepared, we have understood all the types of process of ointments. Let us understand that how this packaging of ointment occurs. Packaging of ointments plays a very important role, because until and unless we pack the substances in a proper format or proper packaging, the extent to which it is going to provide its efficacy may not last for longer time. As a result, packaging or the initial framing of the medicament plays a very important role, because if the packaging is intact, the product is intact for several years, and the shelf life of the product is actually extended if packaging is done properly. So, here I would like to make you all understand that when we are packaging ointment, what is the very first thing that we are keeping in mind? The thickness of the ointment, how often it is going to be used, what is the major purpose of the ointment. If the ointment is being used quickly, or if it is used for bulk purpose, then ointments are oftenly supplied in wide jar containers, wide mouth jar containers. However, if it is used in a quick for small sort of illness, for small sort of diseases, then it is supplied in collapsible tubes. These collapsible tubes can be made from any sort of metal. Sometimes plastics are also used in order to manufacture these ointments, or in order to manufacture these collapsible tubes. Our ointment is being filled into the collapsible tubes, and from the one end we apply pressure, and from the another end the material or the ointments comes out. So, this was all about the preparation of ointment, the different methods used for the preparation of ointment and packaging of ointment. So, I hope this lecture was very informative to all of you. Thank you so much.